This is Lama Tantrapa. Welcome to the Secrets of Qigong Masters and the series of video interviews dedicated to the Master of the Month. And today I'm delighted to introduce to you Dr. Philip Young of Sunnyvale, California, who's the founder and president of Nine Star University and a Qigong master in his own right. And I want to thank you, Dr. Young, for taking the time to share your knowledge and wisdom with us today.
Thank you for coming. Thank you for the interview.
We decided to dedicate this series of interviews with you to the subject of personal development for the healers.
Okay.
And of course, I would like to begin by exploring what does it mean to be a healer. What would you say it means to you?
As a healer, first, you can make the right diagnosis in any approaches, such as find the root cause of the problems. For example, it's a stomach pain. So stomach pain, so okay, what do you do? And so you need, before you do anything, you need to find out what's the real cause. Is this gastritis, infection, ulcer, or just gas, or neurological pain? So you need, when you find out what's the real cause, then that will be easier for the treatment. Then as a treatment, if you find out it's an infection, you need to do something, or if it's necessary, you need to send to the emergency. If it's an ulcer or bleeding. But if it's something chronic, bloating, pain, or something, then you can do something. Use Qigong, use needle, whatever you can, just do it. Then, another case, if someone has a cramping pain in the stomach, very, very painful, then we can use the Qigong. One is the Qigong poking, the Qi poking with just poke some of the points. Within 1 minute, the pain goes away.
And by poking the points, you mean acupressure?
Acupressure with Qi.
Well, doing acupressure without Qi would really be just poking. So what's the difference between poking versus acupressure?
Okay, acupressure is you press the point and rub it. Or you give a lot of pressure. But this poking is just one time. One time, then different points. That's it.
And of course, it also depends on whether or not there's Qi deficiency or stagnation, so that you may be poking stronger or less, or in certain direction.
This is why you need to be a healer. As a healer, you can control how much of the strength you need to apply, and how much of the strength the client can accept. So when you do it, always do it properly. So when you figure out what's the problem, you know how much strength you need to apply, and how much strength the client can accept. And another way is when you touch the body, touch the client, you know how much he or she can take. Otherwise, if you overdo it, they feel not comfortable. But even this, no problem. Just don't damage the body, but mostly not. So you can control.
So the number one principle of medicine is do no harms, right?
Right.
And of course, that also means that a healer needs to understand not only technique, but also what the client is ready to experience. Because sometimes the person may not be ready to experience a radical change in their energy makeup or physical tensions, and that creates a sort of imbalance that the person is not used to. Or perhaps they're just not feeling like themselves, and so they will revert back to their habitual way of being. How do you address that as a healer?
Okay, yeah, that's also very, very important, because when we find out what's the root cause, and also what's the cause of the cause, that means in which way you get this problem. Like many, many people have stomach bloating. Stomach bloating, someone has the burping, gas, and reflux something for many years. I have someone 30 years or 40 years. I said, did you get any treatment? And they said, yes, I tried various kind of treatment, medication, including anti-acid medicine, prescribed over-the-counter, and also Chinese herbs, acupuncture, various ways. Just cannot get rid of it, can moderate the symptoms. Okay, so what's the cause? It's very, very easy. If we can use the spinal diagnosis to feel the spine, we find muscles bend to the left. Then we have the way needles or Qigong or plus acupressure to align the vertebrae, then they can be fine. Then the gas will be gone. And that's why when someone says the gas right now, they want to burp but cannot burp out. Okay, we use the poking or use needles within 1 minute can moderate the symptoms. Then, what's the cause? The cause is the postures. Either sitting posture this way, or someone watching TV like this and then falling to sleep. Then just bend to the side. And habitually, they just do it that way. Then that, after some time, they will form the problem, the bending, the deformation.
Right.
Then we will tell the patient, okay, don't sleep on the left, because someone is caused by sleeping. Always sleep on one side. And when they tell them why, and tell them how to correct the position, then they will avoid the cause. No cause, no root cause, and then that's gone.
Interesting. So we're talking about personal development for healers, and obviously you are a healer, and you probably apply this to yourself for your personal development. So how do you work with your own spine? I mean, observing your posture, I see that there is some spinal misalignment, so I wonder how you work with your own misalignments, and how can healers do that for themselves?
Okay, I can feel myself very easily.
Sure.
And then I'll have the needle, that's a holographic needle, to put here. Not necessarily to put it here. And actually, if you put it here, it usually doesn't work. Mm-hmm. So put it here. So it's so easy. Put one needle, then do some movements, then the disc can be aligned. The position can be corrected. Yeah, this is how I work on myself. If the healer want to heal themselves, usually, to me, this is the solution for me. But they have to get either needles, or they don't get the needles, they have to get help from someone else.
Well, and of course, interesting thing about postural misalignment is that they're physical manifestations of certain states of consciousness. For example, if I am sad or depressed, I'm going to have kyphosis or hold down. For example, if I'm aggressive or pushy, I will be holding forth and have tension in the back of my neck and throughout the length of the spine. If I, for example, feel really arrogant or self-important, I may be holding up. If I'm skeptical or perhaps just try to be cool, maybe I'll be holding out. And so that creates each of their own type of misalignment. Do you address these misalignments in their own ways, and do you look at the root causes of the cause? In other words, why does the person hold himself like this? What can we do to help the person become less arrogant or less aggressive or less depressed?
Yeah, first we see the postures. Then mostly we can figure out what's the cause, but sometimes we can't. So we have to ask the client what's a sitting posture, including something they're not aware, like driving. The driving, sometimes this way, and someone sitting on the desk. We just mentioned these aspects which is related with your daily life, working, sitting, or even sitting at home. Some of the patients say, oh, your treatment works, but only lasts for 1 or 2 days. After that, the pain come back again, the tension come back. Then I knew it was not my problem, because after treatment, right right away get looser, not supposed to come back, but there must be a progressive reason or cause to keep getting the problem. Then I asked, that's a 75 years old lady. Then I said, do you have any habitual posture to make your head tilt to one side? Then she said, oh yeah. I always, because she usually live by herself, watch TV every day until she fall into sleep. She would sit on the sofa, watch TV, then fall into sleep. Always on this side, habitually. So that's the problem. That's because, the tension of the neck on the right side always. I said, okay, don't do it again. Even if you do it, you can put a hold on your neck to avoid falling on either side.
Like a traveler's pillow.
Yeah, like that.
But of course, the reason why her neck was falling always to one side was not about the neck. It was about the rest of the spine. So the neck is just the top of the structure. If the foundation is crooked, of course the structure will be tilted and the top will be falling off to the one side.
That's right. Usually the problem is not just single problem, it's multiple problems. But this is maybe the first part, almost a severe problem pop out. So attract our attention. But then when this is correct, we also correct another part. Maybe there's no symptoms, but we can fix it first.
Great. So all of this explains to us your approach to healing. And what is it like to be a healer as compared to an ordinary human being?
Of course, healer is more intuitive and more sharp to find the problems. And the regular human beings, they're not aware of it. And to keep the habit, I like this. I like to take coffee, I like to take spicy. Okay, this is my habit, this is my favorite food. So they're not aware of it until they have the problem. Then someone point out, this is the cause. You take too much red meat. You take too much seafood. You take too much spicy. They said, oh, we have to cut it off. So that's the difference. They don't aware what's the lifestyle and cause the corresponding problems.
Well, this is something that I had to deal with. You know, I ran for a number of years a Portland Qigong clinic. I saw many clients coming to me with a variety of different issues like that. And of course I prescribed certain postural changes, certain lifestyle changes, dietary changes, changes in the way people moved or what they did with their bodies when they exercised. But when people would go back home, often I noticed all the benefits or some of the benefits of seeing me would evaporate because they would revert back to their habitual patterns. Mm-hmm. They would forget the homework that I would suggest, or they would get distracted with a million of distractions that everyone has, mm-hmm. or it just wouldn't feel so important, or maybe they even had some internal resistance to mm-hmm. being told what to do, mm-hmm. because often people don't like being told what to do, mm-hmm. and so they just don't follow through on the homework that they were given. And so I had to develop the whole new approach of working with clients. I call it Qigong coaching, where I coach the person to essentially discover for themselves what would be the most beneficial way for them. Mm-hmm. And then when they decided that this would be the most beneficial way, they were not being told what to do. They actually made the decision. It's much more likely that they will be able to do that and won't forget it.
That's right. That's right. That's right. They have to be educated. They have to join the course, the trainings, and they have to listen to what the doctor say, what the professional suggests. But most of the people, they do care about their health. That's why they come to your class. The only problem is that they don't have the knowledge what's supposed to be careful, watch out. Like the sleeping postures, anyone, how many people of you are aware like a sleeping posture can cause diseases? Very, very few. In some of the lectures, I mentioned about the causes of the diseases. Then there's the list of the causes, including dietary, the mental and stress, and emotion, and also work-related, the occupational, and pollution, everything. But and also, of course, it's called the gene. Not mentioning about the sleeping posture. I say, okay, based on the list of the causes in the mainstream medicine, the complementary medicine, I add one more. Independent one page. Sleeping can cause the diseases. Sleeping to the left can cause heart diseases. Everybody knows this. That's why, when I feel the spine, I tell the patient, ask the patient, do you always sleep on the right? They say, oh yes. Why you sleep on the right? Because I know the answer already. The doctor told me I cannot sleep on the left. The sleep on the left can cause a heart disease. I said, I'm sorry. When you sleep on the right, you can cause the frozen shoulder, diabetes, sciatica, and more. This is why. And what's the right sleeping posture? I'm kidding. I said, don't sleep.
So they quit sleeping? Well, I don't think so. I don't think that people will just stop sleeping if you tell them not to. So they probably will go back to their habit of sleeping.
Yeah.
And most likely they will not feel like themselves if they had to sleep in some other posture that they're not used to. Like, for example, I often suggest people to sleep on their back with a minimal pillow, and they say, no, I can't fall asleep.
That's right. Yeah, many people do that. But I said, okay, sleeping habit is something that's really related with the sleeping quality. Maybe you gradually change it. I do have the experience. When I was young, I felt I was not comfortable on this side, but then when I noticed the tilting, I have to sleep on this side. But I couldn't sleep in the beginning. So gradually, day by day, I get used to it. But right now, I also keep the posture of sleeping on the back without moving at all. This is the correct posture. This is the not 100% correct, but at least much safer. But someone uses a high pillow. That's the problem.
Right.
Yeah. So it causes more problem on the neck.
Exactly. And so, as the healer, you help people recognize the issues that they're causing for themselves. And how do you encourage them to make these changes permanent, or step by step guide them to adopt to this new way of being?
We may there are some causes why they have to stay that way. Like if they feel left shoulder pain, there's a lot of pain. When they find sleep on the left will aggravate the pain, of course they have to stay this side. But if they don't have too much symptoms and they get used to sleep on the left, then we have to tell them, do you want to get a heart disease? Do you want to suffer the pain in the chest, breathing difficulty? Of course not. Then you have to change it. Find a way to change it.
So you scare them into changing.
Yeah. That's the truth. Yeah, not to scare them, to give them the awareness, which is going to happen. Another thing is we have to help them to correct the body posture. The reason they feel more comfortable, like someone has the left shoulder pain, then they find, in this way, they feel the pain is reduced. That's true, because the spine is being tilted to the left side. When you follow it, less tension, less pulling, you feel, at least at that moment, you feel more comfortable.
Right.
But this will aggravate the situation.
If you go too much.
Yes. So we have to correct the spine, make it straight. Then they feel, this way it's more comfortable.
Well, wouldn't you say that there is a reason why the spine was twisted or misaligned? And of course the bones don't just misalign by themselves. Usually muscles pull the bones out of alignment, especially along the spinal process.
Yeah, usually there's There must be a cause. Like someone's caused by the whiplash, car accident. Oh, that makes it tilt. There are someone falling down, or someone just certain posture, like walking in the office, L-shaped desk, that causes more problems.
Right.
Yeah, turn this way, mostly on this side, and then sometimes on this side, but then they will tilt to the side. Then after some time they get used to it, because the body formed this posture, this shape already. Then they feel also comfortable turn this side. So have to tell them, correct it. And we use a certain way. Even your spine is being calcified in the bending posture, then we have certain needle techniques called the holographic needle technique. Put on the head, then we can correct the spine, the bone,
the vertebrae.
Then make it more aligned, or enlarge the size to the normal size. Then there's no pinching nerve and no other symptoms. Then they feel this is more correct. Like someone's very, very young, even like 40 years old, they get a hunchback. Yeah, I have some kid, teenager, this way.
Probably texting too much.
Yeah, texting, playing games, typing computer. Yeah, when they do this way, oh, they feel more comfortable. Tell them, straight up. Okay, straight up. Then again, when they feel this is more comfortable, they form already. I said, okay, you still have time, you're so young. Still have time to correct it. Otherwise, do you want to walk like this as the old age people? Oh, of course not. Okay, then we have them to give the needles to correct the posture. The most important thing is your sitting habit. Have to be straight. Don't look at your computer this way.
Right. So it's funny that we are talking about a certain healing procedures. Let's see if we can look into what does it mean to become a better healer. So in other words, I would invite us to delve a little bit deeper into understanding what's the difference between the healer and ordinary human, and also can ordinary humans become healers? And if so, what would it take?
Okay. Of course, every healer comes from the ordinary people.
Right.
You just need some trainings to get the education and do the practice. So education, knowledge, practice, then realization.
And let me add one more.
Okay.
Continuous personal development.
That's right.
You can become a very educated healer, you can have practice, you can do a lot of good to many people, but still feel like something is missing, or perhaps realize that there is still lots of room for improvement.
Yeah.
Well, usually personal development is something that is often missing in the process of becoming a healer, and so once you become a healer, often that's the time to start looking at the personal development, right?
Yes, exactly.
So how would you go about that?
Like in my experience, I'm trained by Eastern medicine and also Western medicine. In Western medicine, very interesting part to me is the anatomy, physiology, and the neuroscience, and also genes, genetics. That the gene techniques is a very and the neuroscience, the nerves, it's very corresponding to the Eastern medicine, like the yin, yang, 5 elements, and corresponding to the activities, nerves, sympathetic nerves and parasympathetic nerves. One is for hyper, one is suppressed activities to keep the yin-yang balance. And our energy have the same nature, exactly the same nature. Yang energy to make you hyper, yin energy to make you calm down. So both have to be balanced. If it's not balanced, you're out of order. Too much yang, you get insomnia. Too hyper. Too much yin, you get depressed. So this energy is really corresponding. So through the knowledge in both sides, it really helps us to recognize our problems to make the diagnosis and do the treatment. So I do encourage anyone who is interested in medicine, or you really want to be a healer, you need to be educated from both sides. Like in my class in Nansha University, I do have several students who are, one's an MD, the other is a dentist, the other, of course, are nurses. And when they learn that, they feel, oh, I do have a lot of change of my ideas of the human body. But when they combine together, they do learn much better than others. So as a healer, you can take the classes. If it's you don't want to be a professional, you can just take the classes by interest. Also, like a Qigong class, medical Qigong, and TCM foundation, like the foundation of traditional Chinese medicine. And also, you want to know the meridians. Very, very interesting, very, very practical. You can learn that and apply on yourself or for others. It's very, very helpful for promoting your health. And also, you can learn the herbs, the herbology. Herbology, then you can apply this herbs knowledge in your daily cooking or something. This is just by your interest. Of course, when you want to be a professional, you need to get all the trainings systematically.
Right. So we're talking about education.
Yeah.
That is one of the 4 pillars, so to speak.
Yeah.
And then the other pillars that you mentioned were practice and experience. So practice makes perfect.
Yeah.
In
That's
other words,
right.
if you can, if you have all the knowledge in the world, but you're not applying it, your knowledge is still just theoretical.
Exactly.
And often people who have a lot of practice, they discover that things they learned in school aren't really usable so much. Often people say that they went through acupuncture school just to get a license.
Yeah.
And then the real education begins when they start seeing patients on a regular basis.
That's right. There's many, many people. When they graduate, so 1 year, they were in one school in Southern California. Just one trimester, they have over 100 people graduate, get licensed. Oh, they got a big party, celebration. We get a license. We passed the license exam. After party, everyone, what should I do? How I can do it? No money to open a clinic. Nobody want to hear me because I'm not experienced. So they really get frustrated. And that's the truth. That's why in our school, I always educate the students. When you just enter the school, prepare to be ready when you graduate. Ready to be a doctor. How? Of course, very, very get a good scores in our didactic training, and also clinic training. Clinic training, you really need to be there. It's not just take the hours. After you exhaust the hours, you meet our requirement. I'm done. Nothing. Yeah.
So what we're looking at is then people who graduate from a graduate school to become acupuncturists or doctors of Oriental medicine often don't have the street smarts, so to speak, or the real world wisdom, how to establish themselves in an authority in this particular field, how to identify what kind of clients or patients they're really feeling like working with, and also how to develop a business and how to establish rapport with their clients and patients so that they would be able to see them on a more regular basis, and also perhaps develop not just a one-off type of offering like, okay, I'm going to give you a pill or I'm going to poke you with needles, but develop a program for each person that would lead them along the path of becoming healthier and healthier, which is something that is really what makes the big difference between the Western and Eastern medicine.
Yeah.
Unlike the Western medicine, which usually just addresses the symptoms right on the spot, prescribes certain medication or procedures, Eastern medicine often helps the person to follow the path of becoming healthier and more vital and greater longevity. What would you say would help the healers who are watching our videos to develop this attitude and just confidence that would allow them to become the trusted authority for their patients and clients, to guide them along the path of greater health?
The confidence is built up by your practice. Actually, what you mentioned just now is really correct. You learn from the book. Yeah, I have the confidence. I have the knowledge. But when you go to the clinic in the practice, you find it's not useful. It's so different. Who can make the right conclusion for this patient? I know what's the problem, what's the right method to treat it. Who can say that? Only the practitioner who did for the patient. And it really works. Then you are very sure this problem is caused by this, and what's the diagnosis, and what's the treatment method. So there are a lot of techniques and also theories, including diagnosis. Let's say, example, like a migraine. Everybody know migraine. So many people get experience with migraine. How many people in their life get experienced for headache? 90% of the people in their life, more or less, they get the experience of the headache. For migraine patients, migraine we know by the medicine right now, Western medicine, is that migraine is not treatable.
There is no discernible cause of migraine either.
That's right. That's right. There's just no clue to find what's the problem. Let me tell you my finding. The reason I can say this is my finding and it is right, just because I use it every day in the clinical practice. When I put the information in my website, someone searched, migraine. I can treat the migraine. I really can treat it. Can make it completely go away.
And not come back.
Not come back. But of course, you can tell them what's the cause, what to need to be careful. One day, I was doing the health fair in Centerville. Then there's someone came here to the booth. I was there. She said she has migraine for 42 years. I said, "Hi, you come to the right person." Then she said, "You can treat migraine?" I said, "Yes." Then I make the diagnosis, everything. I said, "For sure I can treat a migraine." She said, "How long it takes?" I said, "Give me a couple months." She said, "Couple months? That's nothing. I suffer for 42 years. Even you treat me for 2 years, I'll be very, very happy." I said, "Okay, how about I treat you 2 months, you pay me more." Just kidding. So I said 20 times, 20 visits. She said, "Okay, I'd love to." Then that's for Sunday, that's the health fair. Then she came on Monday. She said, "I can't wait." Then I give her treatment within 10 visits. Actually, after 6 visits, no more pain. But I did 10 visits for her to stabilize it. She didn't come for 3 years. Then she came another time. She said, "Oh, these days I find a little bit headache. So I don't want to get migraine come back, so that's why I come back to you."
Pain is a strong motivator, isn't it?
Yeah. She's really scared of the headache attack.
Sure.
If she has a headache, the pain scale is 1 to 10. What's the maximum? She said 12. Then she has to take the medication when she has the sign. Take the medication. Then after some time, the medication works to suppress the pain. Because when the pain reaches over 8, she'll throw out, and dizziness and scared of the light. Yeah, throw out. Very, very bad. So really scared. Then she came again, so I give her 1 treatment. So far, it's been 6 years. She didn't show up. No news is good news. So actually, there's many causes. Many clients have the migraine. So what I'm trying to say is the migraine. How I find out the migraine is related with the spine. This is the root cause. Because every migraine patient, I feel spinal diagnosis, oh, it's here. Then reverse. When I feel the problem here, I'll tell you, you have a headache. Oh, they say yes. Someone say, no. I said, you will have it. And when you have the headache, mostly on the right, almost on the left, because it will show up here. And that's why I said these, the spine, the vertebrae, is the root cause for migraine. Right. There's a related cause, including the diet, stress, hormone. Like someone has the migraine, when they have menstrual period comes, then more migraine. Yeah, that's just a trigger. And someone, for no reason, just have that migraine, mostly stress. And someone take some food. After take some food, like too much spicy food. Someone take coffee, and someone said reverse.
Even chocolate can cause migraine.
Oh yes, more heat. Someone have the migraine when they take the coffee. Oh, get better. I said this is temporal release. That's why they take more coffee. But actually, coffee might be the cause for migraine. They say, okay, I feel better when they take coffee. Yes, you collect more heat. Then migraine again. Oh, take more coffee. You get more heat. Then the situation will get worse, and worse. One of my clients many years ago, he got a migraine. I said, coffee is your root cause. You need to cut off coffee. He said, what? I don't take wine. I don't smoke. I don't take drugs. Coffee is the only hobby left. If you take out my coffee, yeah, what is significant to leave?
Well, so he probably would really benefit from help find purpose in his life.
yeah, about coffee.
Well, and speaking of purpose in life, it would be probably really interesting to our viewers to see how finding a purpose in life for themselves would be one of the crucial elements of personal development. What would you say is your purpose in life, and how would you describe it to other people?
Okay. Oh, that's really varies. Like someone said, the purpose I live here is enjoy the life. Enjoy the food, enjoy my life, enjoy the traveling. But I don't think most people can have this enjoyment. I think everybody wants to enjoy the life, enjoy the traveling, scenery, relax. Everybody wants it, but everybody is not everybody is ready. We have to fight for survival. Yeah, I think that's the problem. And someone said, I don't care about the material things. I care more about the spiritual pursuit. So they do a lot of meditation and retreat or praying or something. Yeah, that's their pursuit, their goal. And someone said, oh, I have a higher pursuit, was to go to heaven. Yeah, that's a different purpose and different pursuit. So it really varies. But at least, no matter what's your goal of the life, what you need to facing as survival and your health. Your health is the key. If you don't have good health, no matter how much money you have, you cannot have any enjoyment. Every day is suffering. Or you can survive with drugs. Then what's the quality of life? So health is the most important thing. Many people who have the death experience, they realize, before I work for 7 days. Right now, I only work for 3 days. Why? Hey, you're a workaholic before, but why you can detach so much? You just work 3 days. He said, after the heart attack, get ER. When I come out, I realize what's the significance of the life, what's the most important thing of the life. Health is the first important thing. Otherwise, to say nothing about the enjoyment, happiness and joy, no way. So I do suggest everyone care yourself, love yourself, and love your family. If you don't love yourself, don't care about yourself, just work and do this and that and greedily and this and that, okay, one day when you get sick, not only you suffer yourself, you give the burden for the family, you give the burden to the society, and you have no quality of life. At that time when you realize what you should do, that's too late. Do it right now to enhance yourself, the health, mentally keep you well and detached to certain things, not attach too much, not be greedy to anything, just be fine. And of course you can try your best to work, dedicated in your work, in your family, everything. You can try your best, but you have to care your health also.
Right, so self-healing is an important aspect of personal development for healers. As they say, doctor, heal thyself, right? So it's one of the key elements of personal development if you are in health profession especially. But there are other aspects of personal development that relate to our way to communicate to other people, how we relate to our community, how we establish a certain level of responsibility, both self-responsibility and also responsibility among other people. And that's the only way to facilitate the responsibility of others. If we just tell people to be responsible for their health or for their well-being or other things, but we are not the role model of that, people will easily point the finger at us and say, look, that's hypocrisy. You are not being responsible yourself. So developing self-responsibility and ability to respond to the needs and changes in life is one of the key aspects of personal development for any person in the healing field. How would you facilitate, or how would you suggest to our viewers become more responsible in their lives and also responsible on a more global level?
Most people, when you give them any suggestions, they say, oh, you're right. But they also get the excuse. I said, okay, you need to do the exercise regularly. No, I'm very busy. I tell you the truth. Every day, 6 o'clock, I have to go to work. Then when I come back from work, 9 o'clock, I just eat and take a shower, just go to sleep. Then ready for the next day. 7 days a week or 6 days a week, or on weekend, take care of my family. Okay, no matter what's the excuse, you always can find a time for you to relax or do some exercise. Do you have lunch break? Do you have 5 minutes break during the work? After you're sitting, you work a lot, how about you stand up and do some stretch? Go outside, do some deep breaths. Of course, if you learn the Qigong techniques, it's much easier. Qigong technique, we have different types, different forms of the exercises, including standing meditation, movements, sitting meditation, breathing techniques, visualization, and just relaxation. Like breathing techniques, you can do the breathing and Qigong practice while you're driving without interfere your driving. And plus, if you do Qigong very well, you can have the multitask, driving and breathing, the Qigong technique, Qigong practice, and also even you can listen to some music.
Of course, hopefully you're not driving on a freeway full of exhaust fumes, because you don't want to do breathing techniques saturating your body with all the chemicals, right?
Yeah, of course. You need to check the environment. But here, I think in the US, it's very clean. It's no problem. So then when you are working, there's a programming technique for Qigong. Like say, oh, I have a very intense work when I come to the office. That's fine. Program today. This working is the Qigong practice. Just a mind, a second. Okay, that's it. You start working means you start Qigong practice. Then after the work, it's time for lunch break. Okay, closing. Then go to lunch. Even you said, go to lunch is also Qigong practice. Okay, that's a Qigong practice. So this is kind of very free daily practice, Qigong practice. It's so easy to do. And this effect will be much different from just work or just do anything.
Well, of course, some of our viewers would be asking, what kind of Qigong practice do you do while you are working, especially if you have an intensely engrossing type of job where all your attention is required?
This is a working Qigong. We have a sleeping Qigong. We have walking Qigong, running Qigong, and working Qigong. And independent movements, sitting, breathing techniques, that Qigong. And various types. Qigong practice covers every aspect of your life, 24/7.
Very nice. Will you be sharing these particular practices during the upcoming workshop?
Oh, yes.
For, dedicated to personal development for healers?
Sure. That would be very practical for anyone.
And what else will you be covering in that workshop?
We mentioned sitting meditation, standing meditation, and Qigong movements. These are the basic and the most important thing to start Qigong practice. So that means every Qigong beginners have to start these practice, especially movements, standing meditation. And then, after some time, you do the sitting meditation. So this is, for sure, we will be covered.
Right.
And next, breathing techniques. Breathing techniques, you can apply it in your daily life. Mm-hmm. And then, some of the healing techniques. We teach the specific grasp of immortal magic hands, so you can get the effect right away to heal yourself and heal others.
Fantastic. Well, since this is going to be our joint event, I imagine that a lot of our presentations will have some overlap. So perhaps not to overlap too much, I would personally add the practices that you haven't mentioned. For example, practices dedicated to improvement of flexibility and range of motion, mm-hmm. and the strength training. So the practices essentially lead not only to be able to more relax better, mm-hmm. but also have greater strength when necessary.
Yes.
So if you need to spring into action, you can do that.
Yes. And how about the flexibility?
And flexibility is a crucial thing, especially if we understand that physical flexibility is just a somatic manifestation of a mental flexibility. Uh-huh. Without being mentally flexible, you cannot become physically flexible and vice versa.
Yeah.
And so you essentially develop a more flexible organism that mm-hmm. includes the mind and body.
Yes, yes. Yeah, we may demonstrate to the students some martial arts practice which is increases the flexibility and also strength, combine them together. So because I started the martial arts practice when I was young, then learn Qigong and practice Qigong and teach Qigong.
Right.
Yeah. So we can all share all this information. Of course, this is a 2 days consecutive workshop, right?
Right. Saturday and Sunday.
Saturday and Sunday. Very intensive, but we'll make it very interesting. Very strengthful and enjoyable. So we get alternatively intense, relax, intense, relax. learning practice.
Exactly.
And maybe we can play some games, Qigong games.
Absolutely. Qigong games are one of the favorite things of mine, mm-hmm. because I really like to make the practice more fun rather than rigorous and austere. Uh-huh. And what makes it more fun than game.
Yeah. Yes.
And that also engages another person
Uh-huh.
So we're not just doing Qigong practice on our own. There is a camaraderie. There is a certain feedback that we receive from another person. And then we can also take turns. So different roles in this game can be taken by one or by another individual. And sometimes there may be more people than just two involved in the game.
Yes, yes, that's right, that's right.
And one of the things that I will personally add to that is the development of certain attitudes. So some people would say this is not Qigong, but if we realize that these attitudes have everything to do with energy awareness, whether it's being more centered or more grounded or more responsive rather than reactive, all of these are essential elements of Qigong studies, even though they're not practices like you do something. It's more the way of being. And so that's something I think is probably a crucial aspect of personal development for healers.
Yes, yes. For some techniques, this we can make it as a game, but also as a practice things. I once in a Qigong demonstration, there's hundreds of people, the audiences. I just tell them to hold one thing, mostly hold a Coke. A Coke, easy to taste. Or you have the wine, that's fine, something special taste. Then you get a whole 2 cups. One's the original cup, you can mark it, number 1, number 2. But the same quality, same one or same Coke. Then everyone hold, no matter how many hundreds of the audiences, you hold one, pick up number 1. Okay, everybody to pick up number 1. So I can send the qi to only your number 1 cup. Then, so to change the taste, then after 1 or 2 minutes, you test it. 1 and 2, it's totally different, much more plain.
Oh yeah, so you can make wine turn it into water.
That's right.
Can you do the other way, turn water into wine? Like Jesus Christ?
I can't.
Oh, bummer.
I need to practice more. I need Jesus Christ to train me.
Well, then the whole wine country up north of here will just go out of business because nobody will need wine anymore. Just take water.
I can steal there.
Well, and of course this is also an important element of personal development, not only for healers but for any human being, is understanding our values and beliefs, and how our values and our perspective on life creates our reality. And so that essentially leads to becoming much more involved in creation of our own reality and therefore becoming more responsible for our experiences. Rather than feeling like the reality is what is being given to us, or that's what is being done to us. And so we are victims of the external forces that are doing something to us.
Yeah, you mean the environment upon us, right?
Environment, people around us, society in general.
Everyone, you should have this ability to deal with the environment. This is not something you can control. You can control. No matter how weak you are or how strong you are, you have to deal with them. So the fundamental thing is that we have to be strong, mentally strong, physically strong. Let's say, okay, there's a flu. Okay, here's the flu. Someone say, always like I have some patients. Okay, this is the flu season. Before they get flu, he get flu. When anyone get flu, he definitely get flu. When his flu is healed, he's not healed yet. So, just suffer from repetitive the flu, cold and everything. Why is that? He's too weak to facing the winter. Even this is California. This is much better than East Coast.
It's very mild.
Yeah, very mild, but he's so weak. So that means you really need to do something to strengthen yourself. It's not the environmental problem, it's your problem. So you have to get the awareness and really do something. Don't just wait, medicine, herbs. That's not the solution. So Qigong is the fundamental solution for yourself, for the self development. Then, when you physically is stronger, mentally you'll be stronger. You know, I have some patients, they always worry. Hey doctor, I really worry. I have pain here. Is this cancer? I have a pain on the side. It is a heart attack. Do you know how long I'm gonna survive? Listen, I'm sorry, I'm not a fortune teller.
You're not a fortune teller, but you can tell them that even if you survive, you will be living a miserable life if you're constantly worrying. So
that's right.
the quality of life is going to be really low. And how do you help people stop worrying?
When they have the physical problem, I can help with the physical problem. I just tell them, okay, by my experience, in my diagnosis, you do have the physical problem. This makes you feel pain on the left. Even this heart area, but it's not heart disease. Of course, you can go to the doctor to have the EKG. You can have the all the images and tests to check if you have the heart disease. If you do have it, the worst case is just take a medication. We have all the medications. But if you don't have it, I can, through my treatment, can make it completely go away. How's that? Okay, and when I heal this problem, your worry will go away. Do you trust me? I don't know. I said, okay, I do it today. See, if you feel better tomorrow, less worry, less pain, or pain is gone. Yeah, many people, they experience that. Oh yeah.
Well, so what you're describing is that you do something in terms of treatment for the patient.
Yeah.
And then you hope that their worry is going to go away.
Yeah.
But wouldn't you say that their worry is their way of thinking? It's their modus operandi. So if they don't worry about one thing, they will worry about something else. It's just a standard operating procedure.
There are two major causes for the worry. One is they're maybe genetically, mentally just weak, just born that way, just always worry from young age. So this may be also related with the environment, all happening in the life. But I do some patient, there's nothing new to worry. I even wrote an article about this patient. She's from England. Very pretty, very pretty kids, very good husband. She's young, only early 40, and don't need to worry about anything. Everything's good, but she worries every day. So worried that she can't fall into sleep. At night, she worries this, worried about the kids, worried about the school, worried about health, worried about something's going to happen, disaster. Just think anything. There's no reason. So this is something mental problem.
Anxiety.
Yeah, and exactly, it's very severe. The only thing is that when they take the antidepressant, they feel better. But they really don't want to.
Well, it's not really about antidepressants. The antidepressants will not remove anxiety. They may reduce it to a certain degree.
Yeah.
Yes, they only treat symptoms. I actually have at least 99% effective way of working with the root cause of anxiety. The person who's experiencing anxiety would have to be coachable. In other words, the person is open-minded enough to understand that they are the ones creating anxiety. It's not somebody doing it to them. Because once the person takes responsibility for that, then they can do something about it. And I can literally walk the person from being extremely worried or anxious to being free of anxiety and worry in a matter of 2 or 3 months, or less, sometimes in 1 month. It's just a matter of coaching them rather than trying to fix them, engaging in basically in the self-healing process of eliminating anxiety and removing the root cause of it. I will probably introduce that in our workshop as well. I think it's going to be a lot of fun for healers because some of them may have some worries as well.
Oh yes.
And if they work with other people who have anxieties, well, that's going to be a really good way to implement this practice. Really simple and elegant solution to such a major concern as anxiety.
Mm-hmm. Yes, yes, that would be very, very helpful. Very interesting.
Great. Well, speaking of the workshop, of course, we want to invite our viewers to join us for that live event. It's going to be happening in March 14th and 15th of 2015 in Sunnyvale, California. Please join us for this event. Just Saturday and Sunday. It's going to be from 10 o'clock to 5 o'clock p.m.
Yes.
And it's going to cover the most fundamental practices and principles of personal development for healers, regardless whether you are a licensed acupuncturist, a massage therapist, a chiropractor, or a healer of any other modality, or a practitioner of Western medicine. You will be able to develop much greater sense of presence, ability to work with people with confidence, and also guide them towards greater health in a way that is taking responsibility for their own health rather than constantly wishing that somebody would fix them. This is an event that you cannot afford to miss. Please join us by clicking the link below this video and join Dr. Young and myself for this phenomenal workshop on personal development for healers. Thank you so much, Dr. Young. It's been a real pleasure. I look forward to our conversation at the workshop and sharing whatever we have to share with all the people who are going to join us.
Yes, thank you.